So someone will state their questions, or will I hear their questions?
You should be able to hear the question.
Okay.
We're going to mute everybody, but we'll unmute when I ask the question.
Great.
All right, so we're going to rename this to URMC or okay. All right, so we got a bunch of people, and we're going to spotlight him. There we go. Lights on. Everybody else is muted. Good morning. My name is Chip Partner. I'm the Assistant VP for Communications at the University of Rochester Medical Center. Thanks to all for joining us for the first of what will be a series of virtual media briefings on different topics. Today, I want to thank our ASL interpreters, Will Hayes and Chris McQuaid. And our topic today is SMD students, School of Medicine and Dentistry students getting their degrees early. We have Dr. David Lambert, the Associate Dean of the School of Medicine and Dentistry. And two students who graduated early yesterday, Dr. Katie Harmer, class of 2020. Good morning, Katie. And Dr. John DeGuardi, class of 2020. Katie is in Irondequoit, and Dr. DeGuardi is in Ballston Spa, New York. Now, these briefings that we'll do periodically are not news conferences, but Dr. Lambert will explain a little bit about how the early graduation process worked, and then we'll just open it up for questions in order. Rather than one question and a follow-up, we'll do one question per reporter and then come back if we need. And with that, I will ask Dr. Lambert to say a few words.
Great. Good morning and welcome. As he said, my name is David Lambert. I'm the Senior Associate Dean for Medical Student Education here at the medical school. Medical school made a decision to graduate its class of 2020 earlier than expected, and that conferral of the degree ceremony took place yesterday. The reasons for doing that were our medical school, along with other medical schools in New York and some across the country, recognized that the health crisis the United States is facing with the COVID outbreak is going to require more people to help care for all of those who are sick. And by graduating our medical students early, we've given them the opportunity to either go home and spend some time with family before they begin their residency, or to volunteer either here in Rochester or other places, or to be employed by the Strong Memorial Hospital or by the hospital where they're doing their residency. As physicians, they will be able to provide direct care to patients under the supervision of other physicians in New York State.
Thank you, Dr. Lambert. And now we'll open it up for questions. I'm just going to go in the order I see them on our Zoom venue. And I think first is 13 Wham. And I think I saw Jane Flash in the studio.
Yes, hi. Can you hear me okay?
Just fine,
thank
Jane.
you.
Yeah, I would like maybe to address questions to our two new doctors first. What does it feel like to graduate in this environment and be pressed into service in this pandemic? I would like if maybe each one of them could address that, please.
Dr. Harmer, maybe we'll start with you and then Dr. DeGuardi.
It feels absolutely surreal to have graduated in this time. Definitely not how we thought we'd be graduating. I think I can speak for many of my classmates in saying that we feel deeply grateful for the education that the University of Rochester School of Medicine has provided us with over the past 4 years. and also deeply grateful for this opportunity to graduate early and for the confidence that they're showing in us and making us available to go meet the needs of our community in this time of great need.
Yeah, I can echo what Katie said. I feel very grateful and fortunate to have studied here at the University of Rochester. I think they've prepared us very well. I think this is a nerve-wracking time for a lot of people, but I feel grateful that I'm able to graduate and in a position that I can provide some help and assistance to those who need it.
Doctor, thanks so much. Next, I see Beth Adams from WXXI News. Beth, we're not hearing you, or you unmuted? You're unmuted on our side, Beth. Should she hit star 6?
She may need to, because she's on the phone.
You may need to hit star 6, Beth.
Oh, no, she muted. Unmute. Okay, she's on.
Beth, can we try again? Go back to Lambert.
Yes, can you hear me now? Sorry about that.
Yep, you're just fine.
All right, my question also goes to the two newly graduated physicians. Do you know specifically where you will be going for your work during the pandemic crisis and what exactly you'll be doing?
Why don't we go to Dr. DeGuardi first? And sir, if you'd say your name, I'm afraid I'm mispronouncing it.
No, you got it right. It's DeGuardi. So yeah, that's you did a great job. Yeah, so we don't really know where we're going to be working at this point. We've been told that we will have the opportunity to work here at the University of Rochester, but in what capacity, we don't know yet. And both of us, Katie and I, are in contact with our residency programs to determine if it would be an option to go to our residency programs to start working early. But as of now, we don't have any specific information about what capacity we'd be working in or where specifically we'd be working.
I can just echo what John said. We don't have details yet about where we'll be working or if there will be opportunities for that, but hopefully we'll know soon.
And next is Brian Sharp. Then I see Gary McClendon from WROC or whomever's at WROC. So Brian, do you have a question?
Yeah, I guess for the two doctors, new doctors, if you could talk about what are your specialties, and also was there any preparation, added preparation before you graduated to give you a sense of just how to practice at this time with COVID and how that's going to affect how you practice?
I may need to comment. I'll let you know if I do or not.
Dr. Harmer, why don't you go, then Dr. DeGuardi, and then Dr. Lambert will say something about that.
So I'm going into family medicine, and I chose family medicine because it's a specialty where you can take care of anyone regardless of their age or their gender or the organ system that's causing their problem. And I think that feels really salient right now, as there's this need in our community that was unanticipated, and I think we feel a duty to go and meet that unanticipated need. The school has prepared us very well. In addition to the training that we've had over the past 4 years, we have this week-long course, usually right before graduation, that prepares us for being new physicians in a very practical way, and they moved that course up. So we had that course last week.
Dr. DeGuardi?
Yeah, I'm pursuing the field of emergency medicine, and similarly to Katie, chose the field because I think you can take care of a variety of patients, whether it's adults, kids with a variety of different illnesses. You tend to have to know a little bit about a lot of different things, which makes this field useful in a situation like this. So I think, looking back on it, it was a decision that I made not in light of COVID, but now that under these circumstances, it seems that it is a field where that is in need. And then regarding Preparation, I mean, we've spent 4 years studying medicine and preparing for our residencies, and the school has done a great job in doing that for us. And then, like Katie said, they moved up our last course to help prepare us specifically for graduating early. And then we touched on some COVID-specific topics that helped us get in sort of the mindset as sort of what to expect as we enter the field. But I imagine that there will be further training and guidance as we get specific, get in a specific idea in terms of which capacity we'll be working in.
And Dr. Lambert can address that question too, Brian.
Yeah, just briefly, I want to be sure that everyone understands that the students meted all of the requirements for graduation, and the school went through the appropriate processes with accreditation agencies and things like that. So our students are extremely well prepared. The nuances about caring for a COVID population, although they've been taught that here, will be further trained. They'll get further training wherever they're employed or where they do their residency.
Thank you, Dr. Lambert. And Sabrina Maggiore from WRFC Channel 8.
Hi, thank you for taking my question. So in terms of the students who have now graduated, in what capacity will they be fighting COVID-19? Are they going to be dealing with any patients under the supervision of doctors at the residency who are dealing with COVID-19?
Lambert?
So the details have not yet been finalized, but Strong Memorial Hospital is following the recommendations or the executive order by the governor that they will have a license to practice medicine. They will be caring for patients with COVID, suspected COVID, and those without. So they will be physicians with some supervision by more experienced licensed physicians.
And I don't see a name. Spectrum News is on the line, I believe.
Yes, this is Wendy Wright with Spectrum News.
Hi, Wendy.
Thank you.
Wendy.
Hi there. Congratulations, doctors. This has probably been a whirlwind for you. I wanted to see if you could each just talk a little further about this process that you've gone through and how you feel about it. I mean, you've been in school for, I don't know how many years, maybe you can let me know, to get to this point. And, you know, I know, Dr. Harmer, you mentioned that this is an interesting time to become a doctor, and people are really recognizing the folks who that are on and will be on the front lines, and the community's been so thankful to you. So just wanted to get a little more of your personal thoughts on all of this.
Let's go to Dr. DeGuardi. I think he's up first this time.
Yeah, I can comment on that. I mean, you know, I feel quite privileged to be in this position, to be able to help. My dad loves to reference a op-ed that was written in the New York Times in 1994 regarding everyday angels. And I think that during this sort of time of crisis, a lot of everyday angels are becoming more apparent. A lot of people have had to step up and provide different services. You know, I have a friend who's a music teacher, and he's, you know, being innovative using Google Classroom and YouTube to teach music to his students. My mom is teaching exercise classes to her YMCA students via Zoom. My aunt, who does interior design, is sewing masks. And then, you know, there's plenty of other people, you know, working on what you could argue are the front lines to keep our grocery stores open and people fed, and waste management, in addition to all those hospital workers. So, you know, I can't help but be inspired by all those people, and I'm just feel fortunate to be in a situation where I have a service that can be potentially helpful. And when we were informed of the potential opportunity to work after we graduate early, I you know, thought about all those people in my life that have inspired me and the people that inspire me every day. And I feel fortunate to be able to contribute to this cause.
Dr. DeGuardi, I love that sentiment that there are so many folks working on the front lines, and the front lines look different in different settings. I know that just to answer specifically the question about years, we all went through an undergraduate training, which for most people was 4 years of undergraduate training, and then additionally 4 years of medical training. So Dr. DeGuardi and I have completed our 4th year of training at the University of Rochester School of Medicine and Dentistry, and that's led us now to having our MD degree as physicians. I think, echoing what John said, I feel that it is an incredible privilege to have been able to receive all that training and have all these resources given to me. That's led me to this point where I now am a physician. And I think that with that privilege comes, for me, a duty to serve the community that's brought me here. And I think I've never felt that duty so strongly as I feel it right now in this time of great need for our community. I feel that it would be an absolute honor to join this effort with the entire Rochester medical community and working to keep our community safe during COVID-19.
Thank you.
I really want to praise all of our students because this has been an upheaval for them in their personal lives with family that they're probably worried about locally and distance away. And they've showed tremendous resilience as things have unfolded very rapidly. It's also important that everyone understand that they are given an opportunity to potentially work here or at other places, but there's no obligation to do so along the way. We know that they'll do what's right for them before they enter their residency in June, where they will be caring for patients all over the country.
Thank you, Doctor. Will Astor is the last journalist I see on the list. Will, before you ask your question, if anyone has a follow-up question, I'll ask if you can use the chat function at the bottom of your screen just to say, I want to ask another question, because we can take more questions if you wish. And with that, Will, I'll ask you to put a question in.
Okay, thank you. Dr. Lambert, could you elucidate more what the accelerated graduation entailed in terms of coursework preparation and what it replaced to what the process would have been otherwise?
Sure. So thank you for that question. So medical schools in the United States are required to have 130 weeks of instruction. Our medical school had 153. Our medical school has a lot of elective time, which is time that students can pursue things of their choosing. And so the decision was made to reduce the required elective time by 5 weeks. And so that meant that our students completed 148 weeks of coursework, far above the 130 required. The last course of the year that was described earlier is a capstone course that brings a lot of things together and sends our students off to practice. And so we were able to move that course earlier, so they got that required element before they graduated. It's important also to understand that the medical school has been working in the same constraints that everyone else has with appropriate distancing, and we are delivering our curriculum virtually because we cannot have people in close quarters. And we've been able to do that and deliver the right education for our new doctors.
Okay, before we close out, we are getting a couple of follow-up questions for Dr. Lambert. I'm going to warn Dr. Harmer and Dr. DeGuardi, you don't have to, but if you have any final thoughts that you'd like to share, we'll give you that opportunity in a minute. Dr. Lambert, one question is, how many total students are in the 2020 class that graduated early?
Sure, so there are 99 students in the class. That's the traditional size of our medical school class.
And from Jane Fleisch, do we have a sense of how many folks in this graduating class will stay in our community?
So we know that as far as residency programs go, that 18 of those students will be with us for all of their training, and about 30 total will be in New York State overall. The rest of them will be scattered throughout the United States.
And Brian Sharp asks, can you speak, Dr. Lambert, to the local needs of UR Medicine and the number and specialty of needed physicians within UR Medicine?
Sure. So if you're asking about what physicians are going to be needed in order to handle the surge of patients that is anticipated will come, is that the majority of the roles that our early graduates could see themselves serving have to do with internal medicine, caring for patients who are in the hospital, as well as emergency medicine, taking care of patients when they come along the way. And regardless of what the student's specialty choice is, they are appropriately trained to take on those roles for this short 6-week interim.
I'm going to warn my friends in the media, we may start doing all questions by chat, because I think I can combine 3 questions in one, and they're all for Dr. Lambert. Did all 99 students agree to start working immediately? How many will begin to work right away, and when will we know where they will be working?
Sure. So thank you for that question. So it's important that the decision to graduate students was to give them options, not to give them obligations. And so around 70 of our graduates through a survey indicated an interest in learning more about this opportunity. Since they completed that survey, and now the environment has changed a little bit. Some of their residency programs are offering them to come to those hospitals early, and so some of them will go with those opportunities. The Strong Memorial Hospital is developing a job description that those who are interested will be receiving in the next day or so, and then they will make a decision about whether they will be able to do that. It's important that those who work here are able to commit to a certain period of time in order to get them adequately trained in the nuances of the care of COVID patients here at Strong, and to provide some continuity through that.
Thank you, Dr. Lambert. Dr. Harmer, I do have a question for you, and it's, have you lived in Irondequoit your whole life, and where did you graduate high school?
I lived in Irondequoit from the age of, from birth until age 18. I went to West Irondequoit schools through 8th grade, and then I went to Allendale Columbia School for high school. I left Rochester after high school and went to Yale for my undergraduate degree, and I am very glad to be back in this community for medical school, and I'm also staying here for residency in family medicine, and I plan to be in this community for a long time.
And Dr. Harmer, was there anything else you wanted to say? Because I have the same question for Dr. DeGuardi, just a little bit about your personal background. But Dr. Harmer, is there anything else you wanted to say about being a graduate of the School of Medicine and Dentistry?
I'd just like to reiterate my gratitude to the school for the training they've provided us with over the past 4 years, and for the confidence that they're having in us in graduating us early and giving us this opportunity to help our communities.
And Dr. DeGuardi, the similar kind of question, can you just tell us about your background, where you went to high school, where you grew up?
Yeah, I grew up in Ballston Spa, New York, which is north of Albany. And then I completed my undergrad at Hamilton College in Clinton, New York, and then further migrated to Western New York and did medical school here in Rochester. And then as far as concluding words, like Katie said, I too am very grateful for the experience I've had here as a Rochester medical student. It's been a tremendous experience. I've learned and grown a ton, and this is a challenging time, but like I said before, I'm inspired by all of us in the community that are doing work to help each other, and I'm feel grateful to be in a position where I can contribute to that effort.
Okay, I want to let you off the hook. I do want to say how proud we are as a medical center to have you two as graduates. But I'm going to allow 2 final questions, I think, and this is for both of you, starting with Dr. DeGuardi. Were you able to celebrate receiving your degree yesterday, and if so, how did you do that?
Yes, I was able to celebrate receiving my degree. A couple friends drove their car in front of my house and started playing the graduation song on their speakers, and they brought a bottle of champagne for me, and a couple of other friends also paid a visit. So I felt very fortunate and loved, and I received a lot of support from the friends and family that I care about. So that's what graduation is all about to me, and being around the people that I love and who have supported me through this process. So the short answer to your question is yes, I was able to celebrate in a manner that I felt was fitting.
That's great. And Dr. Harmer, same question for you. Were you able to celebrate yesterday?
Yes, it wasn't the celebration that I had imagined 4 years ago, but I think it may have even been better. My entire extended family drove up to the lawn outside my apartment building and organized themselves in little groups far apart from each other, organized by household. And they brought signs and instruments, and they played Pomp and Circumstance and cheered for me. And I felt very loved and very grateful for everyone who's gotten me to this point.
Okay, I am going to close questions now, just so we can honor, we wanted to keep this to half an hour. I wanted to ask Dr. Lambert about the virtual graduation ceremony. There is going to be a little bit of a more formal virtual ceremony, and then we have a question about residency before we close.
Right. So the conferring of the degree ceremony was virtual as well, and that's available on our website. And the commencement ceremony is going to very much follow a traditional commencement with comments by President Mangelsdorf, Dean Taubman, as well as our faculty, student, and guest speaker. And then we will read the names of the graduates and show their pictures. And that will be one continuous stream that will be available to be downloaded, and the students be able to keep that.
Okay, and I'm sorry, I'm going to allow two more questions because I think we missed WHEC on the call. But before that, Dr. Lambert, we had a question of residency. When will these students start their residencies, and is the work that they would be doing now just between now and residency?
Yeah, the work that they would do if they should choose to be employed either here, Rochester, or otherwise is separate from the residency. Most residency programs begin at least their orientation in the second or the third week of June and start their employment as an intern a week after that. So either the last week of June or July 1st. That's fairly uniform across the country and across programs.
Thank you, Dr. Lambert. And Patrick from WHEC. I'm sorry, we didn't see you in the list, but thanks for spitting in the chat. So can we unmute him? How does that?
I don't see him in the list.
Sorry, Patrick, we're having technical difficulty. Let's see if we can get that figured out. Patrick, if you could type your question, I've got a couple of house cleaning items. One is I want to assure everyone that we are practicing proper social distancing techniques. Dr. Lambert is not wearing a mask, but we are more than 6 feet away, and we are wearing masks because we're coming from the hospital environment. Right now we're standing in the School of Medicine and Dentistry, which is not a clinical care area. All of our media attendees should have received some imagery, a link to the video that Dr. Lambert described, and the white coat ceremony photo that these two doctors, I believe, are probably pictured in from 4 years ago. Dr. Harmer and Dr. DeGuardi, we've had several requests. If you have pictures of yourselves, just maybe celebrating yesterday or just a headshot of yourself, if you could send that to Lori Barrett, who I think you've interacted with already on my team. We've got several media requests for that. And are we getting a question from? Unfortunately, Patrick, we just cannot figure out how to get your audio up here, and I'm going to have to close this out. There will be a recording of this and our future media briefings on our website. We're going to give Patrick just a second to ask a question if he can. There we go. Oh, I know everyone met the requirements. Does this mean they are board certified physicians?
Board certification comes after training. So if you do pediatrics, you're board certified after you finish a pediatric residency. But they are eligible for licensure by the state of New York at this time. And then when they go to their residency, they will also be licensed by the state in which they are training.
All right, thank you everyone for participating. We especially want to thank and congratulate Dr. Katie Harmer and Dr. John DeGuardi. Thank you, Dr. Lambert, for your time and our friends in the media. We probably will have another one of these events on Monday, and stay tuned for word about that.
Thank you very much.
Thank you.